Dr. Anthony Fauci says that without proper precautions heading into fall and winter, the United States, quote, could have 300,000 to 400,000 COVID-19 deaths. That is, of course, a horrifying prospect, but not necessarily a surprising one, given the lack of adequate leadership on the part of Donald Trump and his White House. In fact, not only is the administration failing to lead, they're actively doing harm at this point. USA Today counted 23 instances just since September 1st of this year when Trump or his own staff defied their own CDC's coronavirus guidelines, and that was before Trump returned to the Oval Office this afternoon. Joining our conversation, former Obama White House Health Policy Director, MSNBC medical contributor, our friend Dr. Kavita Patel. First, I've got to get your take on where we stand with the president who is either in the grips of this experimental treatment, still contagious, rattling around the residence, and heading over to the Oval Office today.
Yeah, it's a great question, Nicole, that we're all wondering about it. And you can imagine that a number of my medical colleagues and I are furiously texting, trying to make sense out of what little public information we're getting from the president's physician, who sent out pretty much non-statement statement that said, the president is feeling great. And we know that watching patients with COVID-19, that not only are they highly infectious, but we're hearing something publicly that is not jive, honestly, with what we know in taking care of patients who receive the kinds of treatments the president had. Everything from that antibody cocktail to the antiviral to dexamethasone, the steroid. It's a pretty consequential treatment. So I have to, and then on top of that, hearing that, the White House is kind of secretly contacting Gold Star families who were at an event Sunday, that they were in contact with someone who was positive, and yet we still are being told that we don't want to look backwards when asked about the president's last known negative test or what the efforts for contact tracing have revealed. And I think all of this, Nicole, would be in and of itself insane. But what's even more insane is hearing that the president wants to participate in a debate, and yet then not having these answers seems reasonable enough for people like Vice President Joe Biden, his entire staff, and all the people involved with the Trump campaign to put themselves at risk. It's just mind-boggling.
Let me ask you, though, about the White House itself. I mean, I had the privilege of working there. It really is a special and sacred place. It is now the site of a super spreader event, and people that had the privilege of going to events there, the ceremony to honor a nominee to the Supreme Court. As you said, the Daily Beast is reporting this hour that veterans group that brought Gold Star families to the White House for an event Monday, which is much earlier than the White House has acknowledged a single positive COVID test for any of the, I think, 17 or 18 people now in the president's orbit who have turned up positive and are sick with COVID. What should be happening at the White House right now?
Yeah, and I can't underscore your comments about how truly sacred the grounds are in terms of the staff that are there and the privilege that goes along with being one of those staff members. That has all been violated. What should be happening is not just standard contact tracing, Nicole. I mean, this should go well beyond what's standard, because it is one of the most kind of sacred institutions, not just from, the fact that it's a privilege to work there, but the exposure, to your point, the number of people that are in and out of that complex, as well as a matter of national security. I mean, now we've got not only, Joint Chiefs of Staff, Navy Commandant. I mean, we have dignitaries that are visiting the staff that then also visit those dignitaries. So This is a big deal. The three things that need to be done: deep cleaning. We've seen some photo evidence of that. Number two is not only reducing the number of staff that are in contact with the president, that entire complex needs to be dramatically reduced in terms of staffing. And then the third thing that needs to be done, and I can tell you right now that it's not being done, the third thing that needs to be done is extensive contact tracing along with continuous support to make sure that people who are contacted get tested. And I have no proof that any of that is really being done on a consistent basis.
we have proof of the opposite. A lot of people who were in and around those events saying they haven't been contacted. Dr. Kavita Patel, thank you so much for spending some time with us today.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.